Now, another 627 deaths with coronavirus have been confirmed in UK hospitals, taking the total to 32,692. Laura Bundock is in the newsroom for us. So just break down these figures for us, Laura.
Yeah, Mark, we've got the figures for all four nations. So if we take a look at England, first of all, in England, we know that a further 350 people are confirmed to have died, taking the total number of deaths in the nation's hospitals to 23,709. The Midlands was the worst affected area in the latest figures, with 78 fatalities. Earlier on, Scotland reported another 50 deaths, bringing their total to 1,912. Wales recorded 16 more deaths. Its total now standing at 1,132, and there have been 9 more deaths in Northern Ireland. The total in Northern Ireland, 447. Now, it's interesting that figure from the Department of Health does seem quite high, 627 more deaths. We know that if you look at the figure in England, that 350 daily increase, around 100 of those are deaths which happened more than a week ago, so that might account for that larger number, but it does seem to be a bit higher. We know that the Department of Health figures are now taking into account not just deaths from people who have died, who've tested positive for the virus in hospital, but also those who've tested positive outside hospital, so in care homes, particularly in the community as well. But that does seem to be quite a big increase in the daily number of deaths. We know that the true figures we need to wait a little while for. They're the ones that come out with the Office for National Statistics, and these are the figures that take into account both confirmed cases and suspected cases as well. It also breaks down exactly where the deaths are happening, in hospitals, care homes, in people's homes, in the community as well. And that's really important to see the different trends. Overall now, what we are starting to see is that in all settings, deaths are beginning to fall. We knew they were falling in hospitals, but they had been creeping up in care homes as well. In care homes, they are now starting to decrease too, which will be a great relief, I think, to the care sector, because there'd been a big fear for some time that while deaths in hospitals were falling, which meant the pressure on the NHS was easing, the pressure was very much there for care homes. I think it's still there, clearly, but it is starting to ease off.